So, how's it going? You've been leading Washington State's health system response to
Yep.
COVID-19 for about 2 weeks now. Is that right?
2 weeks. Yesterday was my 2 week mark. Yeah.
I imagine you've had to hit the ground running. What has it been like to step into this role?
Well, it was very fast paced. I'd been following the news before I came out here because, well, everybody was looking at the numbers and watching to see what was happening. So I had a good idea of what some of the numbers look like coming in. And so from the start, my goal was to make sure and take care of the healthcare workers who are on the front line. So that's always been a part of what I've been trying to concentrate on is how do we take care of the people who are taking care of the patients. Then my second goal was to be able to make sure that we optimize the healthcare system and all the resources here in Washington State so that we could take care of the maximum number of folks. And then my third overarching goal was to keep as many Washingtonians safe and to prevent as many losses as possible. And so in order to do that, coming here, I had to get up to speed very quickly on what the elements of the government were doing and how they were interfacing with the hospital system. And I had to become very familiar with the hospital system as well to see how they operated with each other. So it's been kind of a sprint, but we're kind of now at what I hope will be a steady pace, but we're not letting our guard down by any means.
So, Seattle was home to the first coronavirus case in the United States. Now it seems to be there's some projections that are showing containment strategies are really working. Deaths aren't necessarily rising as quickly as they are in other states.
Mm-hmm.
That must be encouraging. What do you take from that?
It is encouraging. I'm cautiously optimistic, and I'm cautiously optimistic because we also have a fair amount of experience in observing how this virus works. And because it is so easily transmitted, and that it is transmitted oftentimes from people who are asymptomatic, we're not able to, I don't feel that we can let our guard down. So I'm cautiously optimistic. It tells me that the safeguards and the guidelines that, especially here in the state of Washington, that the governor has put in place are working. They're effective. He had implemented the social distancing. He had also given guidance against about not having large gatherings, and then just right upon my arrival, he'd been able to direct large businesses to also minimize the number of people that they were having, and actually in some cases, had them all switch to teleworking if they could. So. We see that these strategies are having an impact, but we also know that there's still a level of viral transmission that's going on. And so we still have to get as upstream as possible to prevent that and to get to a spot where we can manage and anticipate reliably where the virus is going to start manifesting itself again.
On Sunday, the governor's office also announced that Washington State actually has a surplus of ventilators and is returning 400 of them to help other states. Can you talk a little bit about that decision and sort of how states are working together on this?
Yeah. Well, we had done a tremendous amount of work in the state of Washington, and in working with the hospitals and the health systems, we had realized that we had quite a few ventilators. We had at least 1,000 ventilators across the state. And we also knew that there were an additional 500 that we could use from ambulatory surgery centers, that we could use them as ventilators for patients as a temporizing move should we need to intubate them and then send them to a higher level of care. But we had also received, as part of our planning, we had also received the first half of our shipment of ventilators from the Strategic National Stockpile. And we were in the process of deploying them. But because we started seeing some improvement in our hospitalization rate, and we were starting to see our death rate drop a little bit, we took stock of how many of our ventilators that we had just distributed would actually need to be utilized. And so of the 474 that we distributed to the hospitals, we were able to recover about 411 of them. and send them to states where they were needed, more eminently. What we have in the pipeline is we had before, or at about the time that we had received our ventilators from the Strategic National Stockpile, we had also gone ahead and procured some additional ventilators. We bought them for the state. So we do have some other ventilators that are coming in. So should we have another surge, we're prepared to flex with the ventilators that we bought.
You talked about sort of first and foremost wanting to sort of give help to our frontline health responders. What can we be doing from home to support our healthcare workers, our frontline responders?
That's a great question, and I really appreciate you thinking about that. I think the first thing that we can do to help our healthcare workers is everyone do their part by staying at home, and it's tough. I mean, I know that for some of us, we're going now on the 4th week of staying at home, and in some places maybe a little bit longer. And it's tough because we're seeing the weather starting to turn spring-like, or it's getting warmer, and so it is tempting to want to be outside, and not that you can't be outside, it's just that you can't be outside in large groups. And you really want to minimize your movement between places, because you just don't know where you can be exposed to the virus at this point. Until we get a better handle on where the virus actually is, it's very hard to predict where it's safe to go these days. So, and then for our healthcare workers and being able to support them, that is a lot, because they're the ones that are having to take care of anybody who does turn sick and become sick.
How are you staying hopeful?
Well, I think that the piece that really is very gratifying to me is seeing how everybody is pitching in. There's so many elements of this response that requires really the whole of society. And I see here in the state of Washington, and I see this as I look across what's happening in other states, people are engaged. They're taking it seriously, and we all must. They're engaged. They're trying to do their part, and I think that we're seeing some type of progress. Like I said earlier, I'm cautiously optimistic. I think we're starting to get a better handle on where things are and what we need to do. So I think there's a lot of optimism in that, but we can't afford to take our foot off the pedal at this point yet.
Yeah. So we have some challenging times yet ahead, particularly maybe a difficult couple of weeks across the country. You've addressed the Longhorn community before. You were UT's 2018 commencement speaker, 2017 distinguished alumna. Do you have maybe any encouraging words for us today for Longhorn Nation?
Yes, I do. I do have to say, even though I'm in the Washington state here now, my heart is still in Texas, and you still have many of my family members there in Texas. And for the Longhorns, our Longhorn community is extremely resilient. I think that Longhorn Nation needs to continue to do their part to contribute, to keep us all safe and do what's necessary to stop the spread of this virus. And in those areas where we have Longhorns working on a potential cure or doing some of the science to help us figure out how we get to the other side of this, keep on doing your work. We need your big brains to help us find a solution for this. But above all, Longhorns, stay safe. We've got this, and you're going to be a big part of this as well. You're continuing to be a big part of this. And so continue your efforts to keep the state of Texas safe, even though I'm not there to help out. I hope that all of you know that everything that you're doing right now is going to help, and I very much appreciate that.
Well, Dr. Bono, thank you so much. Washington State is lucky to have you. The country is lucky to have you. We're so grateful for your service and so appreciative of you taking the time. And we're thinking of you.
Well, thank you. Thanks very much. I was very thrilled to have this opportunity to talk to everybody. And so, hook 'em.
Hook 'em.